Hi, in this video we'd like to talk about uterus shape and size once more. Now we've always repeated that septate and naive uterus are the most common forms of uterine malformation, which means abnormal uterus that a lot of women have. You'll be surprised how many women are not diagnosed or misdiagnosed of their condition. Now we've always repeated here at Antai Hospital that a healthy uterus needs to have an upside down pear-shaped. That is an ideal uterus that can conceive healthily with no complications, full term of a 9 months pregnancy, smooth one as well, and you won't see any pregnancy loss, fetal demise, threatened miscarriage, because that is an ideal shape. So I have here a model. I will also put up some images of HSGs that you can see so that you yourself can compare with your own HSG report. Now, we've always urged that patients, before going for pregnancy, you should do a HSG to check for the uterus shape and size. So HSG is a standard X-ray where they will insert a iodine dye into the uterus to figure out the shape and size. So you can compare them with the healthy one to know whether or not you have a problem, and then you can seek the relevant treatment. So here I'm holding is a model that we use to teach our patients here and also some of our practicing clinicians here about what is a healthy uterus shape and size. So an actual uterus has very little volume, roughly around 5 to 6 milliliters or 70 cubic meters. So it's very little, very small. And then it has to have a shape where it's looking like this. So 2/3 of the uterine body needs to be the upper part, while the lower part of the 1/3 is the cervix. So this rope here is to make that difference of the 2/3 and the 1/3 ratio. So some women have a longer uterine neck where they have more than 1/3, and then the uterine body is less than 2/3, 1/3. This is a uterine malformation that can cause pregnancy complications. So it has to be bigger on the uterine body and smaller in the uterine neck. So we always say it needs to have no indentation. So you can see it can be a dome. This is a good one as well, or it can be flat as long as there is no indentation downwards. As long if there's a presence of any downwards on the fundus, then there is a presence of a septate or an arcuate. Arcuate is simply just mild one. And we've repeated that mild ones can cause the same consequence that severe ones can. So I hope you've understood now that you can keep this kind of information with you, because many doctors are either unaware or they don't let you know such information. Something so crucial that can be the deciding factor of having a successful pregnancy or miscarriage. And we here at Antai Hospital have seen so many cases of pregnancy failures, recurrent miscarriage caused just by this factor alone, because they don't know that their shape and size of the uterus is actually abnormal. Even their doctors, clinical providers do not know about this. So get a HSG done, compare it with a healthy HSG, whether or not you see a 2/3 of the uterine body, a pear shape, and then a 1/3 uterine neck. If you have this kind of uterus, then rest assured you can have a smooth pregnancy. Otherwise, here at Antai Hospital, we offer full contractual treatment. It's a full refund guaranteed because of how effective the treatment is. It's very simple and also very effective and can be done within a day. So corrective surgery using laparoscopy and hysteroscopy to just remove excess tissue on the fundus, and we can restore a shape like this. So get in touch with us via the website if you'd like to schedule an appointment, and then also let's see how we can get this treatment ready for you so that you can begin your conceiving journey without any complications with Antai Hospital.